So today we're going to begin our process by thinking together about the issue of feedback. And instead of using the traditional word feedback, I've chosen to frame today's discussion around the concept of coaching. Coaching reminds me, as I think about it, of our need to focus on improvement and the accomplishments that we're responsible for our learners or staff in the long run. So what we're going to do is we're going to think a little bit together about the characteristics of good coaches. We'll consider the difference between coaching and evaluating because most of us have both of those responsibilities. We'll think about some opportunities that you have. Hopefully you will begin to identify opportunities for coaching in your own area and begin to look at 3 specific tools for working as a coach: orientation conversations, reflective prompting, and RHYME, a framework for performance improvement. And I hope that with these tools, you will have a chance to think about what you are currently doing and consider ways in which you might turn more of your teaching into coaching. So what are the characteristics of a good coach? Certainly here at UCLA, we have the tradition of John Wooden. And you can Google up John Wooden and you will find many opportunities to hear from him about what he thought he was doing that really worked, and from his players and what they felt worked as a coach. So I'd like for you to take just a minute and think about a coach that you've had. Now, it needn't be a basketball coach. I mean, I'm rather short. I never played basketball, but I had a piano teacher. And I thought of that person as a coach, committed to my getting better and being ready to perform in public. You might have had a coach in how to learn a particular new skill that you wanted to master. You might have considered a coach in a non-sport domain. So thinking for a few minutes about what that might be. I was able to give this talk to the Department of Orthopedic Surgery. Let me just share a few things that the residents and the faculty, as they thought about coaches, had to say. They first noted that a coach was a motivator. The coach was the person who inspired them to do their best. They talked about coaches' ability to be amazingly good at observing. So they would notice the little things without forgetting the big picture. They talked about the coach as someone who set the rules, but those rules were clear and understandable and held them accountable for following those rules, such as practice. They talked about the friendship of a coach as someone that they didn't lose contact with. And in fact, if you look at some of the comments from players on YouTube about John Wooden, they'll talk very much about specific instances, which would be 20, 30 years ago, but still has continued to influence their life today. So I hope you've had some kind of experience with good coaches. I think occasionally you've had an experience with a bad coach, but our goal today is to really focus on what those good coaches do, and often our own experience is the best way to start. So as we think about how coaching works, I want to take you to a little YouTube. Let's go back so John Wooden doesn't get totally in our way there. I want to take you to a little YouTube animation about how coaching works. Okay, I hope that gave you a few ideas about what that good coaching looks like. As I watched, I thought of a few things, and I wonder what you notice. Anybody have a thought? What did you notice about that coaching that seemed familiar, that seemed relevant to what we do? Is anybody willing to jot us down and thought or raise your hand? Some of the things that I thought were particularly powerful, and Nancy Wayne is willing to help us here, is that the coach provided the tools rather than just doing the task herself. I love the toolbox, Nancy. You know, it was full of good stuff. Alan Shen suggested that the coach was pushing the learner to take initiative in setting up the plan. So the coach didn't lay out everything about the plan, but was willing to take a little risk, take a little time, if you will, about putting that plan together, if you will. I also love the celebration. That was a part of the learner feeling that they'd reached that goal. And where did that goal come from? It seemed like the goal was something that the coach and the learner had a chance to develop together. And these types of issues are important to us as we think about our role as a coach. I think we're much more often to consider ourselves in the role of an evaluator. So how are these things different? So coaching is something that happens in real time. It's formative. It doesn't go in the written record. You don't put it in MedHub. You don't put it in Oasis and My Courses. It isn't something the learner sees 6 weeks or 8 weeks later. It's really something that happens on a day-to-day basis as an engaged conversation around a specific goal. And our intent when we're behaving in the coaching domain is creating the strongest performance for that learner that we possibly can. And I think for those of you who've taken the time to check in with us this afternoon, that this is probably a goal that you share in a very real, important way. It probably is what keeps you coming back to teaching. But sometimes we have to behave as evaluators, and it's equally important, but it's not the same thing. So when we're in our evaluation hat, it's really more summative. It's something after the fact. It's after the event is over. It's sort of like the judges in the Olympics in the skating. So they're holding up the numbers, but it's only at the end. And it's evaluating or determining the degree to which that learner reached a set of very clearly, we hope, defined standards. And it's our intent that we make it clear to the learner after the fact of what they did accomplish. So today we're really going to focus on the coaching side of the story. So that our role today is the formative, the real time, like the little video that we saw. The focus on feedback or coaching is improvement. And it does require what we saw in the how coaching works. It requires a specific goal. I like the way in the little video that goal, that vision, the cloud with the mountains in it, was really something brought to that event by the learner. It's intended to guide, as a coach, then what are the next steps towards reaching that goal? Now, sometimes the goal is our goal. We've set it. The student has bought into it. The resident is ready to go. And it's not to suggest that coaching is diminished, but only that there are two doors in. One, the door where the goal is set by the learner, and one, the door where the learner knows the goal because it's something that's part of a specific requirement. As you think about the goal, one of the first things the coach has to decide is, whoever set it, is it developmentally appropriate? So in this age of milestones, we've done a little more thinking than we had in the past about, well, what can a first-year resident be able to do? What do we think of second year? So that's still a coaching role, to decide where should this individual learner begin. We've already made we've paid a lot of attention to improvement. The sort of third characteristic is that it's descriptive. It's not evaluative. It's not saying it's good or bad or right or wrong. It is describing the point at which that learner has arrived right now as we're in the real-time conversation. And probably more than any other kind of teaching, it relies on our use of questions. Encouraging through asking, what do you think should be next? What do you want to do next? What do you think would make it better? So that we play a slightly different role in the coaching mode. Just to set it apart for a moment, though, it is more than praise. There was a really interesting study done in a surgical clerkship by Gary Dunnington. What Gary and his team did is they were going to teach students in this clerkship to tie a surgical knot. They divided them into two conditions. One, praise, great job, looks good, keep up the good work, and specific details about the way in which the knot was constructed or not constructed effectively. Each of these accomplishments by the initial students were videotaped. And members of the research team then looked at both the initial knot tied by these students and a second knot tied after either the praise or the coaching feedback. They were also asked, the learners were also asked, what did you like the most? Well, of course, you can guess. What did the learners say? We like praise. What did the faculty members who were judging performance improvement say? What they saw, even blinded to which condition that learner had been engaged in, if you got specific, descriptive information or coaching, the knots were significantly improved from the first attempt to the second attempt. If you were in the praise condition, it was much less likely that improvement occurred. So we're sort of in a bind when we're coaching because sometimes we get stuck on, I really want them to like me. I want those high teacher ratings. My dossier is going up. But when we're thinking about ourselves as a coach, we have to be willing to focus on the very descriptive events and to provide much more detailed information than we might have if we were only thinking about ourselves as teachers. So I think that's a bit of a bind that we face when we move into this role of coach. Now, the students seem to think these are evaluations over a 3-year period from students in their core clerkships. Ask about how much feedback they got, how sufficient it was. And what you can see is it's varied from year to year, But that even in something like internal medicine, where 90% consistently said we think it was sufficient, there's still room for improvement. So all of us in each of our specialties have a challenge in how to improve the amount and sufficiency and certainly the quality of the kind of coaching and feedback that we're able to provide. So why is this such a difficult thing? When you ask faculty, what would you like to have webinars on, or what do you think you need to learn to do as a teacher? Right at the top is feedback. When you ask the students, what do you think the teachers need to do more of, or the residents? It's feedback. So mostly as we think about why it's difficult to give, we're thinking about ourselves. I'm sure you can come up with lots of reasons why it's so hard to give, why it's so hard to be that coach that goes beyond praise. I've heard a lot of excuses. I make them myself. I don't want to ruin the relationship. I didn't really see them do very much. I heard them make a case presentation, but I didn't have time to get in the room. I was really busy. Well, we can talk about I don't have time. It takes too much time to be a coach. And so we've developed strategies for trying to overcome all of those problems. But there's another couple of issues that I think it's worth thinking about why it's so hard, why coaching can be such a hard transition for us. And this is work that was written up fairly recently in Academic Medicine, 2014. Glenn Regehr was one of the authors. He's been talking about this for a while. But he's reminding us that there's two other issues as we think about why feedback or coaching is so difficult. One is the receiver's perspective. So what do they really expect? What are they ready to hear? How stable do they feel in this current situation? How new is it? How challenging is it? How risky is it? So perhaps some of the reason that our students don't hear us when we give feedback is a blockage on their side, and not so much just a blockage on our reticence to talk. But then Regehr goes on to say there's also the barrier, particularly a new barrier over the last few years, as the healthcare situation becomes more fast-paced. There's this problem of developing a relationship. So when you're on attending for 2 weeks, and your team is busy rotating in and off and on of that team, or you're in clinic and you only see this learner once every 3 weeks, there's very little time for that relationship to be built. If the relationship can be built, then we can assure the learners that they are indeed going to benefit from their work with us, that it's safe to work with us, that when we're offering them suggestions, when we're coaching them, it's because we're interested and committed to their improvement. But as he points out, one of the big problems is that we focus too much on what's the best delivery mechanism. And we've not spent as much time thinking about how do you negotiate with very little time available that dynamic relationship so that learners are ready. So Carolyn has a thought about it. So Carolyn, I'm reading these because not everybody can see what you've written. So there may not be a clear right way to do something. Then feedback is viewed as just do it my way. So that is certainly a barrier from the receiver's perspective. So residents often complain that they're taught completely different paths by different attendings. So as we think about this issue, you can see that it is complicated by the interaction between these two. So if the interaction with one attending is very brief and they're very quickly on to another attending, there's relational context doesn't get developed. So the receiver, who's going to do exactly what was suggested they do yesterday, is going to be confused about why they're doing it differently today, why you want them to do it differently today, why your comments are different today, and not appreciate the uncertainty and the flexibility that experts use in accomplishing many tasks. So what I really liked about this article, and I've put the reference here, is I think we've spent a lot of time worrying about what we should do when we try to give feedback. And yet maybe, particularly, I think as Carolyn points out, there's a lot that goes on here in the mind of the receiver, the resident or the student, and the control that we have because of reduced time in this relational context. So I want to suggest a tip that might be helpful in reframing. And I think the sort of reason for today's talk at all is that we want to reframe the situation from what I have to do to give feedback to what we need to do to build a relationship. So as we move into the sort of tips session, I wanted to show you a learner. So this was from a video made by our colleagues in geriatrics, and their intention was to help us think more carefully about how you coach a student, in this case, a student with a lot to be learned. So let me ask you to listen for a few minutes to this student, and as you listen, I'd like for you to write somewhere that you can see. You needn't write this one in public. What you might want to be coaching her about.
Okay, so tell me about Mr. Chamberlain. Oh, he was so great. I really liked talking to him. He's 91. I think his birthday was 2 days ago. And he came in last night from his nursing home. It was Sunset Horizons, which he says he doesn't really like living in because he thinks he can still take care of himself. But his daughters made him move there. Anyways, he came to the hospital because he was having some fevers for the past 2 or 3 days. And he said that he measured them and they were up to 102, but he was using one of those ear thermometers, so he doesn't know if he was doing it right. He thinks his fever was highest yesterday when he was watching Jeopardy, which was right around dinner time. He said he likes to watch Jeopardy every day at the same time, and he's been doing really well with questions recently. So, but the last few nights, not as well, because he wasn't feeling very good. And he said, I don't know, he didn't feel hot when I touched him, so I don't think he had a fever. I listened to his lungs too, and he said, well, I listened to them because he said he was having a cough recently, and he said that sometimes there's some yellow sputum, but he complains that he's been having a hard time breathing.
Okay, so I know perhaps at least a few of you might have had a little trouble hearing. You may need to turn the audio up on your end. We turned it up on our end. I hope that was helpful. This is a student who is probably just beginning one of her clerkships as a third-year medical student, and there's some opportunity for coaching here. So what kinds of things might you want to think about in terms of deciding on a goal? One of you suggested, well, there's a little disorganization going on here. So I'd want to start with some sort of goals that set around the organizational side of making or presenting a case. Anybody else? An idea for what else we might want to coach? What goals might be appropriate for coaching in this situation? So getting the details of each symptom presented at the same time might be a very specific kind of action that could be part of the coaching process. And clearly her ability to flip through all those notes or her preference of flipping through all her notes needs some kind of coaching in terms of making it better. So there's lots of things that we might, at a very basic level, begin to coach this learner about. Brevity. Thanks, Melissa. This attending preceptor might be sitting there for quite a while. I only showed you a small clip. You'll be happy to know. But there are some tools that we can use, and we're going to come back to our learner in a little while. But I just want to suggest a few ways that we might begin this coaching process. So we're going to start by thinking about what kind of orientation conversation might this preceptor want to have. What do we mean by reflective prompting? In other words, what role can the learner play in this improvement process? And some vocabulary that might be helpful in knowing what to speak with her about. So when we think about an orientation, there's lots of different things that I know you talk about when you have a new resident or a new student. You might ask about their prior experience, what their interests are in terms of this rotation, what you expect from them, what they expect from you, what you're going to do, what they're going to do, the schedule, kind of goals or coaching targets, the specific encounters, what you want them to do around specific encounters. In other words, there is an opportunity, if you will, to set clear goals and establish that safe relationship that's going to make coaching possible. Now, I think probably all of you do some of this on day one, the first time you meet a new learner. But one of the things a coach might do is repeat it over time, so that day to day or week to week, there might be new interest, new goals, new expectations, particularly if improvement is happening. So tip number one is that this orientation conversation should not be a one-time event, but could extend over time. It could be one of those reminders when we start any clinic session or meet with a team first few moments of a day. In the inpatient side, it's a little bit like the huddle. So in the huddle, we're often trying to decide what are the priorities today for the patients. It might also be a teaching part and coaching part of the huddle. What are the priorities for those of us who are learning here today? As we think about that, I want to ask you a pretty simple question. So we have something called a poll. So here's the poll. How might you begin your orientation conversation when meeting our student? The one we just met, the young woman in the ambulatory. So select only one of the following. I hope each of you will take a moment to answer. And let's see what kinds of options you would prefer to use. I can monitor completion, so when I see that most of you have voted, we'll take a look and see where we stand. Now, all of these are things you might talk about. We're talking about where to begin. Okay, so let's take a look. Oh, you didn't choose my favorite. The students are particularly distressed when we ask them about their specialty. Because if they say the wrong specialty, the one you're not in, they feel like they'll not be able to work effectively with you. However, if they say the specialty you're in and it's not true, then they might be asked to do things or get a focus that is not very helpful to them. So we're already 100% on as coaches. We know not to start there. So we're sort of split between these other two options. Let me say a little bit about each one. So one of the advantages of asking the learner what, in this case, she would like to learn while working with you is that we can find out if they have goals in mind. Remember back to the animation. In that animation, the person being coached had a very clear goal. The person wanted to get over this, down this highway and into those mountains. Now, not every learner has a clear goal. So sometimes that doesn't work so well. So another option, it looks like we're split pretty evenly here, is finding out more about their prior experience. What we know about learning is that as we learn anything new, we're always linking it to some experience or some knowledge that we already had. It helps us make sense of the new. So this question about what you've done before is one that can be very useful to the learner in terms of thinking about what is relevant. We have a tendency to categorize things, so sometimes it needs a little prodding to say, are you sure? I don't really mean just clinical experience in the hospital or in one of our clinics, but how about in the volunteer work? What about with your family? So that we can help them realize and focus on where they've been in the past. Okay, so tip number 1 is taking the time. Now you might say this word time is always a problem. We don't really have time to do much of anything. But a good 2 or 3 minute conversation, or this repeated over time as we walk to see a patient together, can be done in moments so that it need not be an elaborate sit-down process. Second idea in terms of how we get ready to coach our particular students. And that idea comes from Bing Yu and Trowbridge, written up in JAMA in 2009. And that is what we can do as a coach to prompt reflection. So our purpose in thinking about prompting reflection is that we want to promote this professional behavior so that this act of self-monitoring, this in-time self-awareness can be used to help a learner self-improve and also prepare them to understand what we might coach them to do. It also is a good way to encourage personal goal setting and can help if they feel like that it's something they need to learn from you. It can help reduce the barrier that they feel to accepting. So we're going to talk about 3 different strategies that are related to reflection: relationship building conversations, self-assessment, and self-correction. So in the first instance, I'd like for you to reflect. We'll just do a little of the reflection ourselves. And I'm going to ask you to yourself to simply answer each question, yes or no. Picking a particular learner with whom you feel you've had a coaching relationship recently. Have you demonstrated prior knowledge of the learner as a person? Not as a student, not as a resident, not as an academic responsibility. Have you made it clear that the purpose of your conversation is improvement? Have you acknowledged that you share common goals and face similar barriers? Have you emphasized helping each other so that the coach is a relationship? Did you give the learner a chance to try first without interrupting? Remembering the animation, the learner was allowed to try first. And are your suggestions directives or possibilities? So as you think about yourself in this kind of relationship building conversation, I'd like you again to think about and use the polling. There are five possibilities. And I'd like for you to mark 2 of these building responsibilities that you might need to use more often. Pick 2. This is a little harder. The wonderful thing when the focus is improvement is that all of us can improve. There's a terrific book by Atul Gawande called Better, in which he talks about, as a surgeon, having a coach with him in the OR. And after years of surgical practice, how much he learned from the chance to have someone watch him and coach him. So thinking about what we can all do to be better at building this kind of relationship through our conversations. So let's see what we all feel we need to work on. So it looks like that the most frequent thing that 64% of us felt like needs to be worked on in order to improve our own focus as a coach is to make it clear when we are coaching that the goal is improvement. And I think this may be because the students aren't sure. I think they are expecting evaluation. Oh, if they say something bad, it means I'm going to get a bad grade. I'm not going to get that new honors thing. So thinking about how to make it more clear that our focus is just helping them get better. Emphasizing helping each other. The issue here is that as a coach, we're also learning from how our coaching strategies work so that we're helping each other improve, not just a unidirectional kind of coaching. And this third one is interesting as well. So it looks easy when, as an expert, you accomplish something, whether it's a procedure or a diagnosis or a treatment plan that pops out instantly. Acknowledging is a kind of think out loud strategy of what indeed it does take in order to accomplish this type of outcome that appears so effortless. Well, thank you. This is an example of how reflection might really help us as we go back into, see, I'm not good at getting back. I'm good at the polls, just can't get us back to the slides. All right. So that was an example of how we might use relationship. That's good. A second example is that we need to get better at using self-assessment. From the self-assessment point of view, the easiest kind of coaching that we can do, we can take the pressure off ourselves by asking for self-assessment. How do you think it went? Anything you'd do better? Now, what happens generally is that we get one of two responses. We're all a little afraid this is what we'll get, which is a blank stare or just, oh yeah, it was fine. But some students and some residents are very well prepared and insightful and have been noticing their own actions in order to give us a specific response. We're all more willing to learn if we identify the problem. So this is the most wonderful coaching pathway so that the learner does the hard work for us, lays out what he or she thinks could be improved, what was done particularly well, and we have a chance to simply reinforce or disagree. However, there are a significant portion of our learners who aren't willing to take that risk. We didn't get the relationship established. And so before we give up and just tell them the direct kind of coaching requirements or suggestions, we can ask a much more specific question. We can focus on a specific event, a specific part of the reasoning process or part of the procedure. Only then we'll pick up some portion of our learners who can then give us a specific response and make our job easier. And for some of them, we just have to realize they don't have that level of insight, and for the future, that might be an area in which we would like to work. So self-assessment algorithm is one to keep in mind as a coach to make your job a whole lot easier. And certainly the more sophisticated your learners, the more advanced, the easier this kind of self-assessment can be, and certainly the more of a relationship you've established. The other reflective strategy is self-correction. And Ed.D and Pomerantz Erickson call that the second chance. So when we're to that point where we need to suggest an improvement, it's possible that the learner, in reconsidering, might be able to offer up what should have been done. We've had that opportunity after the fact. We look back and we go, I forgot to ask, or I wish I had done. And this is the strategy here. that as a coach, we can use that ability to reflect after action in order to allow the learner the chance, once again, to take the initiative. Working from the psychological concept that when we feel a need, when we know there's a gap, when we've experienced it ourselves, we're much more likely to move forward. This last one's very interesting. Treat the wrong answer as possible, but in need of further consideration. I was speaking with a faculty member who was concerned when she would hear as a response to a wrong answer, well, just read more. And was concerned that this was not building a real commitment to mutual improvement and support, and thinking more about how you could take a piece of almost any answer and find some way to encourage more thought or to move on more quickly without needing to humiliate. So self-correction requires us to have already established this kind of relationship. Well, as we're coming towards the end, third idea, our first tip being that we want to put a little more emphasis on that orientation period and reorientation period. The second being that reflection needs to be in our little toolkit that we saw in the How Coaching Works. The third is the use of this RHYME framework. It's invented by Lou Pangaro at the Uniformed Health Services University in an attempt to help improve the kinds of evaluations that were being written by faculty members about students and residents. However, as it started to take hold, it's become a framework for improvement as well as evaluation. And his goal in defining these particular stages in the RHYME framework was to describe what that learner would look like, what their behaviors would look like as they progressed over time from being a peripheral observer to having a central role in patient care. So you might say, well, of course, this is a third-year student here at the reporter level, and then we're talking about maybe a fourth-year student and an intern, and by here we're talking about a PGY2. While he makes a point in his work that indeed it does progress over time, it's also true that when faced with a new dilemma, a very real, unfamiliar situation, any of us might drop back into a previous mode. But the vocabulary, if we're coaching, might be about a specific event. So it's not true that we can say, oh, I've got a third-year student, I'm going to have to talk about reporting. So it really means that we're beginning to take a careful look. So think about the student that we saw in her ambulatory clerkship. And let's think about, as a coach, we want to tell her things that are working and maybe suggest or work with her to develop a goal for next steps. Sort of at the reporter level, we're looking for that ability to gather and communicate the clinical facts, then knowing what to look for, recognizing when something is abnormal, being confident to identify and to label new problems, being able to consistently be accurate in the collection of the clinical data, to demonstrate a sense of professional responsibility, and to be honest in reporting only what was done. So as you think about our learner, we probably would all agree that she's now working still on some of these critical features and behaviors at the reporter level. If we wanted to give her feedback, we might find ourselves staying and coaching her about one or more of these issues. But thinking about her a little later in her training, we might find that she's ready, she's mastered those reporter components, and she's ready to move towards the interpreter. The interpreter differs from the reporter in that not only can they identify the problems, they can prioritize them. They offer a broad differential. They're, as interpretation suggests, they're able to interpret tests or to interpret guidelines and apply these specifically to the patient at hand. They can justify a decision by referring to the clinical facts. They actually participate without prodding, so that at the end of their case presentations, they're the ones who speak right up with a suggested plan or suggested differential. And they're comfortable with uncertainty. So in the rhyme interpreter role, if someone has mastered the reporter role, we might use one or more of these phrases to help them set a new goal. Now, if they've already mastered all of these, we might want to focus our coaching at the manager level. Here we're making some decisions about diagnosis. They're making a commitment. They understand the need for fast action. They can modify decisions as things change, as a case emerges. They demonstrate confidence and knowledge and judgment. They know to check the evidence, and they're serving as a interprofessionally positive role model for collaboration and teamwork. Sometimes it's the fact that if you only use self-assessment, they might not be accurate in this. And I think that's one of the points, that this language will help us when we have found an area that a learner might need to focus on as we develop a goal together. So this language is meant to take us beyond self-assessment, or if that self-assessment is accurate, to help us devise that goal for the future. At the next level, the final level in LuAnn's dimensions of language, is that each of our trainees might at some point, or ourselves even, might find ourselves at the educator level. So some of the behaviors here can be used to coach that person who's mastered the behaviors at the manager level. So here we might focus on the inaccuracy of self-assessment to move them to more accurate levels of self-assessment, which we can't do if we don't ask them to try. This person asks questions on their own. They don't need to be asked questions. They're the asker, and they seek answers on their own. They're willing to read. They are the ones providing explanations without being called on. And when being called on, they can provide clear explanations. They know where their limits are, where the limits are in the literature, and we're always hoping that they will demonstrate a sort of maturity of thinking and insight and confidence that is truly appropriate. So what Pangaro and his colleagues have suggested is that once we have a vocabulary, we can be more specific in what we are coaching our students and residents toward in the future. So what I'd like for you to do is I'd like for us to go back to our learner. We'll find her here in a moment. Whoops, where did she go? There she is. So let's take a look at her again and think about that coaching conversation that you might have with her. Reporter to interpreter. Where would you like to go with her?
Okay, so tell me about Mr. Chamberlain. Oh, he was so great. I really liked talking to him. He's 91. I think his birthday was 2 days ago. And he came in last night from his nursing home. It was Sunset Horizons, which he says he doesn't really like living in because he thinks he can still take care of himself, but his daughters made him move there. Anyways, he came to the hospital because he was having some fevers for the past 2 or 3 days. And he said that he measured them and they were up to 102, but he was using one of those ear thermometers, so he doesn't know if he was doing it right.
Okay, so let's think about her for just a moment. If we are thinking about this learner now as a coach, we have a vocabulary, we've worked with her as a coach, perhaps not as an evaluator, and what kinds of things might we want to do differently? So using the question area again, I'd love to have some thoughts. Would you think what's missing here for her is a real orientation dialogue? Do you think that perhaps one of the things that might be most helpful is some sort of reflective prompt? Are there areas in the rhyme vocabulary that might be of use? So I would say that for this particular learner, one of the things that we didn't see that orientation dialogue. We didn't see that sharing of expectations. We're not sure if the learner knows what a good presentation looks like, if that goal has been clear. We're not sure if the expectations have been shared. So that as we are thinking as a coach, it might be that for her, one of the most important things is that ability to remember that there needs to be an orientation of clearly shared ideas. Alan suggested that since she's such an early reporter, the kinds of things that we'd want to talk about during the orientation would really be, what does the presentation look like in this setting? She clearly had collected a great deal of information in her history of this patient, but not quite knowing what one does with it to organize, as Melissa said early, something that's brief but helpful, if you will. So in a sense, two of the tools helped us here. The idea that an orientation dialogue might have made it possible for her to perform at a little higher level, and the use of the reporter phrasing as we began to think about what aspects of reporting might be most helpful to this student. Get me to the end. So I thank you for your time with us today. We appreciate the time that you've spent with us and hope that you will share some of the schedule that's coming up. There are additional webinars. The next one will be on using technology to enhance learning. And we have several more, one on the grading process, one on professionalism. I hope you'll tune in. And as a reminder, they are available for you and for your colleagues on the DGSOM website under the faculty domain. Thank you for joining us today.